See you.
Oh, wow. God is good. So what happens now? Hey, good night. Welcome everyone back to Lana's Little Things. I think we've had dragons in the room, not just gremlins this time. But welcome back, Mr. Lewis. It is so good to have you. And I'm going to have to send the link onto new link that you would have gotten because
Mhm.
this is a new live, so everything is new. So I have to resend it to to the patrons. So what we're gonna do is we introduced you before, but we're gonna just introduce you again, and then we're talking about Men's Health Month, diabetes, and foot care especially, and just overall men's health care. So we're gonna do questions. You're gonna do most of the talking as usual, if you don't mind. So welcome back everyone to Lana's Little Things with me, Dr. Lana, specialist dermatologist, where we talk all things on living agelessly, family caregiving, entrepreneurship, and then we have special occasions like now when we have special guests such as Mr. Lewis, Dr. Lewis Ian, who we've known since before time began, and is a wonderful, not just a brilliant surgeon, but also passionate, kind, considerate, and also very interested in hmm, innovations when it comes to not just medicine and health, but as it relates to the patient's holistic care and especially men's care. That's not misogynistic. That is not. That's not misogynistic. That's actually because you are a man. And so generally, I would expect that you would be more focused on men's health, if that is a correct term to say, because everybody has to be correct nowadays. So, can you hear? If you can hear me still, I am going to send this stream that we are presently doing and send the link on to our audience who has been so patient and been so kind. So if you will, just start talking. They'll join in on the chat and we will go from there. Oh, hello. Somebody's here, Max. Whoever you are, God bless you because I wasn't even certain what was going through. So, Max, welcome. And you can start our discussion as soon as you will ask your questions. But, Mr. Lewis, what can I'm interested in? Hello, I love Snoopy. Oh, this is cool. Um, what would you say? First of all, thank you so much again for joining and for just being there, being a voice, a voice of not just intelligence, but being a voice of um medical know-how in a way that the audience can understand. That makes sense.
Got
So
you,
we've
Lana.
got a more
It's a
international audience this time.
pleasure, more than a pleasure to be here with you. Do we have 1 hour from now, or we've
Oh, we've got as much
crossed
time
them?
as we can because we've seemed to have people from all over. So somebody's asking if you're Nigerian. No, he's absolutely Barbadian. We're not sure where his full ancestry comes, but that's a good interest. That's an interesting thing, Ian. Maybe you should
Uh,
check that
that's
out.
that, that's going to take too long.
Ah, I'm
More
going to move
prepared.
around for a bit, folks. So if you don't mind, Ian, just what you can do, what I would my first question, my most passionate question I would say is we doctor ladies know that gentlemen, whether they be in the higher echelons of society, lower, rich, poor, friends, foes, spouses, brothers, husbands, the last person the man goes to is the doctor, right? We ladies have to get a chisel and a hammer almost to get you guys to come in. Um, as a male, as a surgeon, as someone who has seen people, we could say sadly, at the end of their medical journey, you could say. What would you say is your main concern, or how do you address when men are the reticence or the reluctance of men to go to see the doctor?
Yeah. Well, first we have to, especially in this day and age, we have to define what is a man. Um, I'm not
Make
sure
it
if we have
simple.
enough of an audience for me to throw that into the audience, but Lana, as I tell you, the longer you practice medicine, the more you come up with your theories, the more you kind of have to shift um, your own way of thinking about pathologies and how they should be addressed and so on. I'm extremely happy you're addressing men's health. It is not commonly done, at least not from where I sit at all. You don't hear people talking about men's health for compared to females. I mean, I
Yeah.
am frequently asked to give talks on breast health. That's what I do for a living.
Mm-hmm.
Um, I know what's getting louder and louder, and that's a good thing as well. The management of menopause. Menopause has come full stream now, is out in the open. But infrequently, we get requests to give our views on men's issues. Um, I think you said it right. It's probably a deep thing to get into, defining what a man is. But for our intents and purposes, a man is a human being with an XY complement of our sex chromosomes, right?
Okay.
Bottom line.
Bottom line.
Um, if I'm going to go a little bit beyond that, I would say all of the issues that define a man and all of the issues that become medical issues for a man. Lana, you've disappeared. You're still there? Oh, you came back.
I am. I am. I was
Right.
trying to give me one pause while I shared. Are you back?
Yes, I can see you. I
Oh,
can hear you.
perfect. And we
We're
are
good to
live.
go.
So welcome everyone. We seem to have people from all over the place. So yes, you can go on. Tell me.
Yeah, I would give two general headings as the reasons for men experiencing certain health issues as opposed to female health issues. One heading I would say would be societal expectations.
Mm-hmm.
What is the general rules for being a man as dictated by our community? And the second thing would be
Guys,
this.
you know.
You
Mm-hmm.
there?
That's okay. That's just a little background noise.
Okay. The second
Mm-hmm.
thing would be testosterone. Testosterone. Now, testosterone is the hormone that essentially gives us all the characteristics of being male. Women do have testosterone, just like men do have female hormone, but obviously the quantity, volumes are going to be different. Men have so much more testosterone than women, and it is that hormone that makes a man male. Um, you
Okay.
you may remember from our embryology days, Lana,
Woo.
when that fetus is in the mother's belly. Um, all of the features are identical, male versus female, up until a couple of weeks. So before 6 weeks, you can't tell what is the sex of that fetus. But what happens at 4 to 6 weeks is that um, testosterone starts to have an effect, and well, not testosterone as yet, but the specific gene located on the Y chromosome
Mm-hmm.
results in differentiation of tissue. And if that tissue is going to develop male, then it develops male from 4 to 6 weeks. And eventually, testes are formed, and the testes, obviously, they're the site of formation of the hormone testosterone. And going forward, all of the physical changes that differentiate a man from a woman are brought about because of testosterone.
Mm-hmm.
And we can go forward in phases. We can say, look, this happens at puberty, this happens in your 20s, this can happen in your 40s. That, for me, when I give a talk on male health, I like to do it that way. Health by phases as a man ages. But I want to tap back and just mention a little something on the societal expectations of a man. Whether you come from a point of view of being, a Christian, Muslim, creationist in your outlook, whether you're a pure scientist, agnostic, atheist, whatever, a man is supposed to be the leader.
Right.
All right. A man came first, according to the religions. The man came first, women came out of a man. So it is expected that a man is going to be a leader of a household. Now,
Okay.
heavens be if a man is not seen as a leader and the woman is, then you get the soft man syndrome. And you can read between the lines what that's supposed to be. In other words, society has set up a man to be that strong figure that must always be up front. And some men struggle with that. Some men are not natural leaders. Some men are not naturally emotionally strong. And this can be a source of great stress for a man. But that's the societal expectations of being male and being a leader, and that's a topic in itself, and we're not going to get too deep into that. But what I would say is, in terms of the phases that are determined by our natural hormones and our aging process, lots of things happen at puberty, and lots of things begin to kind of cool down when we get into our 50s and into our 60s. When a talk is given on male health, then obviously the entire audience is going to be expecting that you're just going to be talking about prostate cancer. A
Yes.
man, a man is much more than a prostate that can become cancerous. All right. We're not belittling that illness. It's a very serious illness. In this country, we get more prostate cancer than breast cancer, believe it or not. Our breast cancer rates are seen as being high, and our prostate cancer rates are even.
Is that
And if I were to give
noticeable? Do
you,
you think that is generally known?
I don't think so. Simply because it's not spoken about, and when I say not spoken about, I don't think our medical community is doing as much as they can do in terms of the community education. And I don't think, like we said at the beginning, I don't think men's health is given a push like female health. Female health issues have that surrogate of breast cancer. And once it's being carried along by breast cancer, you're going to be noticed. Breast cancer is very out there and very, as we say, is a very sexy topic because everybody talks about it. You have a whole month dedicated to it. You have the worldwide advocacy that happens and so on. You have famous people suffering from breast cancer and surviving it and so on and so on. So breast cancer pulls along female health. Um,
And women
men,
tend to go in groups too, so they kind of
that's
pull each
true.
other along as well.
Yes, very, very true. But I think it's important to debunk the notion that men's health is strictly about prostate cancer. No. I like to get into the softer, even less spoken areas, even before I get to prostate cancer.
Okay.
Um, And we're just going to touch on them briefly, in the question sessions. I guess people, if you want us to expand on anything, they can send through their messages. We want to talk about, I remember this is all driven by testosterone. So testosterone makes us heavier, faster. So athletic exploits, we tend to do better. We run faster, jump higher, throw farther, etc., etc.
Theoretically.
Theoretically, it gives us a deeper voice, um, gives us a certain hear pattern. And I want to mention here and focus quite a bit on here today because, Lana, are you aware that baldness or the perception of baldness creates a whole lot of anxiety in the male population? Do you get
Yes,
patients
very
coming
much
to
so.
you complaining about balding and wanting things done about balding?
Not as much as hmm. No, not personally. I think men. There's some who have accepted their genetic predisposition. Let's say, oh, my dad was my family have balding. We have balding in the family, and so. But when it starts to happen, I notice that they tend to put the hair across, especially if it's a top. They tend to spread the hair across, and then they seem to me to eventually accept that genetic predisposition. Now, if you're telling me that is different, do explain for our audience. And
Simply
welcome
that
to all
you're
those
right. You're right. I mean,
who are patients.
here thinning patterns and balding patterns can be genetically determined, but not necessarily so. In other words, men who would like to retain or to regain um, tufts of hair, etc., there's a great percentage of them that can be helped. And this is not commonly appreciated because, again, the men themselves, they probably wouldn't want to discuss this with a doctor who would make the relevant referrals. And balding, it can sap a man just like losing a breast can sap a lady of
Really?
femininity. Balding can have a similar effect in a man. So
To
I
that
think
extent, you mean as emotional, as traumatic as that?
it's traumatic. It's traumatic, and throughout the world, what has sprung up would be these hair restoration clinics, and
Well,
they're
that is
doing
true.
very, very well for that said reason. Men would spend a whole lot of money to regain hair.
You're
Hmm.
kidding. I'm not I'm smiling, but that I'm smiling out of sheer incredulity, really. Like women
Definitely.
buy hair for styling and so on. Men but spend money and do that because of the hair loss that they're experiencing? Is that because it's they feel emasculated? Please
That,
explain.
yes, yes, that you're on the right path there. Having a full mane of hair is very important to the masculinity of a man. All right.
Wow.
So I'm just saying that when we're talking male health, balding, there are different causes of balding and potentially different ways of treating balding from one, just giving education that sometimes it can be a temporary thing. Sometimes it can be related to medication use.
Yes.
Sometimes from a therapeutic point of view, sometimes we can give non-invasive methods, the creams to use, and so on, all towards restoring that testosterone and its derivatives, restoring the balance of those. Ultimately, persons can have hair transplants, surgery to regain hair follicles. So balding is the first thing I would say uh, we should consider when you're talking male health? Time is
The
short, so I'm going
first
to move.
thing we should think of when we're thinking of male health is
Mhm.
balding.
If a man comes into your office and he's had a blood pressure check and he's going through a list with you, you say to him, um, "What are your thoughts on your hair loss?" And just hear what he has to say.
I've never routinely done that. That's new.
If he opens up, then the relevant referral is to a dermatologist who will
Hmm.
make a determination as to the cause of the balding and then to refer on, if necessary, to get the relevant treatment.
Whoa!
So don't discount uh, the effects on a man's psyche, especially who is suffering from balding. You know, at around the age of, I would say, 12 to 13, when um, you normally get a natural surge in the female hormone in the body, and this can result in the springing of breast tissue in young boys. And this is something we know well as medics, right?
Yes.
Um, Imagine you are a young fellow and your colleagues are in the change room exposing the chest.
Well, this is it.
And you know what happens if you have sprung breasts at that age, you're not going to take your shirt off.
No.
The minute you do, the teasing you get will hurt you for life. So I call it
Um,
one of the relative urgencies of the pubertal male, gynecomastia, or the growth of breast tissue in a young boy. So it's something that we see as surgeons fairly frequently. Normally, it's the father. Funny enough, I find the fathers would bring the youngsters into a surgeon's office, and normally it's just a matter of reassurance that this is a physiologic kind of response to a natural hormone surge, and that we can wait it out to see what would happen. And you just talk to the youngster and say, look, we understand what happens at school. We understand when you go to the beach, you're probably going to want to go into the water with your shirt on, etc. And normally once you talk it out, you can persuade youngsters and the parents not to do anything until later. If it persists into 18, 19, then that's where surgically we may get involved to do breast reductions.
right. And from what age you spoke about teenagers? So if it is a teenager, because this is intriguing. If it is a teenager who's gonna be still having the effects of he's not finished growing yet, his hormones and all of that, then where is he in the lineup in terms of when you would do surgery? Because would it not grow back? And feel free, anyone in the audience, to just ask your questions. And those who have just joined, who have gotten the link from me, thank you for your patience and for joining in. Welcome. And don't forget to like and subscribe, and we will continue our discussion. Ask any question you wish. Dr. Lewis, Dr. Ian is willing to answer and ready. But presently, we are talking about the most common men's health issue, which is balding. Who knew? Guys, gents,
No,
I
I,
know you
I,
may have a different say from me, but let's continue.
I didn't say it's the most common issue. I just said it's an issue that's underestimated.
Well, that's true. It is
Mhm.
underestimated.
Very
And definitely
underestimated.
underestimated by
And
me.
and we do have the relevant specialists who can handle the investigation and treatment of balding. So don't
Okay.
don't necessarily accept it as a rite of passage when you're getting older. You know, men can start balding from very early, from in your young 20s.
That's true.
It's
That's
not a
true.
60-year-old condition at all. But you asked just now when to intervene if a
Yes.
youngster has emotionally troublesome breast tissue.
Yes.
Because most of these are kind of self-limiting and they will settle out on their own. I
Mm-hmm.
wouldn't go after the breast of somebody who's a young teenager. I will wait until 18. At 18, you're going to
Okay.
get balance of hormones again, and things tend to settle down for most of these kids. So I would say at 18, 19 is when they will consider surgery.
Their major concerns, some of them, many of them have told me about, I met them as adults, and they said their fear started from age 15. So if they're ashamed and if it's affecting them for life, my query then is we're giving them 3 more years of torture, and how do we explain it to them?
You know,
Because
medicine, and especially surgery is a balance. Yeah, so you set general rules, but obviously every case is individual. Every case you have to look at the nuances and the pros and cons. So although I said it would start at 18 with surgical intervention, sometimes we have to start sooner.
okay.
That fellow who is a real cricket enthusiast or soccer enthusiast who wants to be in the locker room looking good with his colleagues and so on at 13.
Yes.
Sometimes they bite the bullet and go. But I would tell you, and you would know as a medic, the emotional distress caused by gynecomastia is great.
I'm hearing that, I'm seeing that more and more as, yeah, I'm noticing that. Is that though because, well, we can get into a whole horse worms of this, but is that because I've been told by some it's because of the foods having so many more estrogen prone contents, soy and tofu, and everybody's like, oh, the diet now is everything has in something that affects female hormones and makes those prominent. So that's why you boys are
I
getting
don't think
like
it's
girls
diet
earlier.
related. It's it's more or less a hormonal surge. So it's from within the body.
Okay.
Um, I can't even invoke, genetics in it. It can happen to anybody. But listen, there's another phase in life. There's another phase in life at which the hormone imbalance will happen again. And
Yeah.
that's in your 50s, 60s. A man all of a sudden who's had a flat chest will come to you with a tender enlargement of one or either breast or both breasts. And it's for the same reason. The female hormone relative to the male hormone, the female starts to rise, and that can give the growth or the spurt of breast tissue. So I get that referral a lot. A man with a one-sided tender enlargement of the breast. And that's the gynecomastia of senescence. That's the other opposite end of aging. So we started with the teenage boy, and now we're into the 60-year-old with gynecomastia. Same diagnosis, same underlying basic biochemistry, exposure to relatively higher amounts of estrogen. Again, most men, once it is explained what is going on, then surgery is not indicated. And of course, there are other causes at that age. Most people would tend to be on medicines for comorbidities or coexisting illnesses, and a lot of those drugs can actually cause breast tissue to form.
Right. Okay. So we got baldness. You're you literally starting from head to toe. So premature baldness or baldness period
Yeah.
recommended to for a male to, well, first of all, we got to get you all in the door, gents. We got to per, persuade you to come see the doctor for your check, if you don't mind me saying so. I That's my impression. I do have
Mhm.
quite a few, I must say, thankfully and quite pleasantly, quite a few, several more male patients than I expected to have. Given that men don't go to the doctors. But it is still a thing. So we've gotten the gents in the room. Then we've started to ask them now about, well, how they are generally, and And at some point, we bring up the concern of hair at any age, at any age.
At any
You know,
age, any age. I know youngsters 19, 20 who are on hair treatments to
right.
prevent and to restore balding. Yes, yes, yes. That we're moving along the age spectrum as it relates to the effects of testosterone. It is not widely known that the sex hormones balance our heart health.
No, that's not
Not well known at all.
widely
With a
known. True.
female, estrogen supports heart health.
Mm-hmm.
In a man, testosterone supports heart health.
Yes.
There is evidence. There is evidence that um, low levels of testosterone, and that's a topic in itself. You know, whether that as a woman gets menopause, which is a state of low estrogen, can a
Right.
man also get the male equivalent of menopause? That's a topic in itself. Because a lot of doctors don't believe in that construct at all of andropause. They don't. But
That's
there
unfortunate.
it's unfortunate, but there's no doubt that there are testosterone deficiency states, whether it be due to organ failure, testicular failure, um, whether it's due to natural aging. Um, Men are more prone to heart attacks, most likely because of heart disease being potentiated by testosterone issues. So saying that to say that in our 20s, 30s, 40s, I mean, nowadays we have to recognize that even youngsters are getting heart attacks. Our
Very much
heart
so.
health, very much so, our heart health as men needs to be a priority when we started out in our professional lives. You need to know that heart disease is real. It's the number one killer in the world. You need to know how to recognize the signs of heart disease. And you need to know how to call for help if you think you have heart issues.
Right. So most men, again, this is maybe my growing up, coming along, thinking in medicine. Most gents think, okay, heart health, I have to go exercise, I have to lose weight, I have to take down salt, I have to like cut down all the drinks, I have to live my life, I have to stop smoking, and I basically have to like never see pork, meat, or anything that I like again, especially in the Caribbean.
Well, you know,
We
Lana,
know this is true.
I people say it all the time. Men explain away symptoms. I'm not sure if they do it any more than women. Both sexes can do it, but the machismo of a man is a problem.
Yes.
Is a problem when it comes to men presenting themselves for medical emotional help. Right? It is a big problem. So a man would get a lump in his breast, and he would stay away from the system because he's afraid he's going to be labeled. He has an underlying suspicion that something is wrong, but he stays away because of the fear as to what the system is going to do to him.
Okay. Explain what that is while I pause for a um medical commercial to get more persons who are asking to come in to come in. Talking about that.
So go ahead and talk.
Yes, please.
Okay. So a man would, at the back of his mind, know that he has breasts, but he would convince himself that only women are prone to breast cancer. Once you have a breast, you can get breast cancer. That's the only prerequisite for breast cancer in 100% of cases, the presence of breast tissue. Men have breasts so they can get breast cancer. So there's this kind of invisible barrier that is set up by a man with a breast complaint to tell him, look, do not enter that doctor's office because you're not a woman. And that fear keeps him away. And by the time he comes in to us, because the lump has been there for a year or more, then unfortunately, in a lot of cases, that lump has spread beyond the breast and his chance for a cure is gone. So the corollary is that women would come early, I'm feeling something in my breast, I don't like it. A man will come and, something's there in the breast, but I don't think it's anything. He's already explaining what it is not, simply because he doesn't want to be labeled as having a breast issue. So machismo in a man is a problem, and it is a very powerful barrier to medical health. And we mentioned breast cancer, but obviously it exists for other disease processes as well. I'm not sure if you're there, Lana. So I'm not sure if I'm being heard, but if anyone, while we're waiting for Lana to come back in, if anyone in the chat wanted to drop any questions, please feel free to go right ahead.
I'm back.
Oh, you're there. Okay. All right. So where
So
were we?
some persons are asking, I know I left you to talk. So I don't want to ask you to, without asking you to repeat what you said, what would be your recommendation?
You've definitely lost me. Recommendation
Okay.
for
Oh, sorry. When we last spoke, I left you to talk about, we've gotten the gentleman in, we're talking about the most common, well, some of the common things: baldness, gynecomastia, general health, heart disease, and testosterone. And moving on from there.
Well, I mean, I think once a man has embarked on his career of work, generally in their young 20s, um, you should, clock into your general practitioner. And it's all about preventive medicine, It's not about showing up only when there's a problem and then you're chasing it. It's all about having somebody on board medically who's going to be looking out and anticipating things and hopefully averting problems before they raise their heads. I'm just making the point that heart disease is still the number one killer, and most heart disease patients, um, the heart disease probably started in your 20s or 30s. All right. So if you're good with the general practitioner, that person should be able to one, educate you as to what symptoms to look out for if heart disease is there, and two, to put preventive strategies in place even before any symptomatology can get started.
Okay. Wow. So I
I
want to
try to make
share with
sure I want to because I know people would want to hear about prostate disease. Prostate
welcome,
disease.
Rhonda. First, before we go further, so we had well, we kept left out dental health, we went to the chest. Um we've gotten people back now, so I
Ah,
am so
good.
pleased. I'm using a laptop and I've been feverishly doing duck in the water work. So welcome all those who have been able to back. Thank you so much for your joining. Miss Adamson, Rhonda, who was with us last time, who really was spurring me on like a gnat to get you back on track on here, which is a lovely gnat though. She's very pretty. She's a lovely gnat. She asked, should a man just get breast screening without an issue being present? Same as we told women. And if so, at what age? Because we tell women 40
Yeah.
or less if they
So
have family history. I think that's an excellent question. Thank you, Rhonda.
yeah, it's a good question. It's not easy to answer because obviously every case that can be prevented is a failure of medicine. Every single case, or every
Yes.
case that we fail to detect early is a failure of the medical system. But the truth is, you can't capture everybody. Um, we do not generate enough male breast cancer for us to even talk about male breast cancer screening. We do not. Just like in this discussion occupied the UK recently, they wanted to start a national screening program for testicular cancer. It's a cancer we infrequently see here, but in the UK they have greater numbers of people. They have quite a few more cases, and they were saying, "Look, we don't generate enough cancer of the testicles for us to have a screening program." So in Barbados, I would say we get probably, if the figures are still holding true, probably about four cases a year or so, compared to 150 new cases of breast cancer in women. So
Wow.
we can't justify exposing men, a population of men, 100 and probably age appropriate, probably about 100,000 men in Barbados per year to radiation, to mammograms, to screen
Yes.
out for four men. That doesn't make sense. But what I
Yeah.
would say is a responsible man should know that male breast cancer exists and should know that having a self examination done a couple times a year is on. He should know that the best position to do it in is the lying position or while he's in the shower with the
Yes.
hands lathered in soap. And probably every 3 to 4 months or so, just take a detailed examination of the breast. What are you feeling for? Anything that doesn't feel normal. That's the bottom line. Once you do it often enough, you get to know what your tissue feels like. And if there are changes, if a lump should come into the picture, then he should know to report it to his general practitioner.
So
So
it's
to
not
answer,
routine.
it's not routine. I wouldn't advise it. It's going to create too much anxiety, and you're going to be looking over your shoulder for something that is hardly going to affect you because the rates are that low.
Okay.
Um, but but the men do need to know about it, and again, that's where a good relationship with a family physician comes into the picture. Mr. X, is good to see you today. I saw you 6 months ago.
Yes.
Anything new? Let's put you on the couch, and during the examination, you answer about breast symptoms and you do a physical examination as a general practitioner as well. So that way, if something forms, either the patient can pick it up or the doctor at a preventive or well man's visit can pick a lump if it is there.
Okay.
But to
I think
answer
that's
Ms. Adamson, I
reassuring.
wouldn't subscribe to screening. No, mammograms, ultrasounds, no, no, no.
He says, got it. Miss Pilgrim, Cheryl, she's medically, she has
Mm-hmm.
medical background, very strong medical background. You and I know her very well. She
Mm-hmm.
asked, hi, how often do you see men I think you kind of just said this. How often do
Yeah.
you see men present with a breast lump? No, can I stick a pin in and
Mm-hmm.
say this year alone, I saw 3 men.
Mm-hmm.
I think that's a record for like any like one private clinic. But for me,
Mm-hmm.
in my entire lifetime, 20 years in medicine, I'm like 3 lumps, and one is in his 30s, 60s,
Yeah.
um, and well, the typical 60s, I suppose, but a 30-year-old was very astonishing and
I
concerning.
would tell you from where I sit, right? The commonest causes for a 30-year-old um, with a breast lump or
Mm-hmm.
breast enlargement
Mm-hmm.
would be alcohol use,
Ah.
marijuana use, or persistence of gynecomastia from adolescence.
This person was from adolescence because there's a history of obesity in adolescence.
Yeah, yeah, yeah. So, I mean, the question she's
Mhm.
asking is how frequently do I see male lumps? Pretty frequently. Because I'm a reference point, people refer
Okay.
to me. I may see more lumps than the average practitioner. I'm guesstimating I probably see one male breast lump every 2 weeks. Every two
Okay,
weeks.
well, my three
And
was a record for you. I suppose yes, you're exposed to it, but that
right,
was
right. The wide
yeah.
spectrum from the adolescents with their, physiologic gynecomastia to that guy who's using a supplement that's stimulating the breast to somebody who's
Mhm.
on the marijuana to that guy who's in his 60s who's now noticing the tenderness because again of physiologic changes. I do see it quite a bit.
Okay,
Hmm.
I
If you
I
can,
I I I'm pausing because I'm thinking this is either very distressing, going to be distressing to certain, to men in general because it's not having breast, not having swelling in your breast is sorry. To have swelling in your breast or to have a lump in your breast is a female thing, first of all. We
mhm,
already spoke about the emasculating effects of it. We already spoke about how shy and fearful almost it would be for a teenager, even a young person, But what you just brought out is exactly what Rhonda just mentioned, the marijuana use, because that if you go, you could walk any corner in Barbados now, and that is, we've got to say it, that, and that's
it's all
worldwide,
over.
and it's
It's all
being
over. Yeah,
touted as a health, it is
yeah,
used as a health product as well, not just a
yeah.
recreational product. So I am like, okay, how are we gonna get them to stop, or where is that coming from?
Yeah. There's no let up. I did an informal study through my office during COVID. Um, it's just something I decided to do. Nothing scientific, but I would tell you, I screened out the male and females from 20 to high 40s, and the rate of marijuana use was almost 100%.
Wow.
Yeah, so that's to tell you in an informal way that our use of it is really high. But it is one of the causes of swollen breasts. So women get breast cancer and men get changes within breast tissue, which can include lumps in a rare way, but they do get changes in the breast that bring them to us eventually, to the medical setting eventually.
Right. Okay. Well, got it. A little, I don't know, I'm clutching my pearls a little bit, but that's interesting to know, and definitely forwards the questions that we can ask.
Yeah.
So
So I want
that
to say,
prompts
Lana,
me to ask
before,
more
because
questions and will prompt the audience. You have
exactly.
brothers, you have sons, you've got your spouses, you've got maybe all the patient persons you're taking care of as family members. Maybe that's questions that can start from at home. It might be a
Mhm,
personal one, but you find a way to get around it.
mhm.
And then in the office, it's for us to medical persons really to be more, I guess, mindful that this is happening. We do know the smoking rate is off the charts, and to just ask that question because they tend to want to, that might be the by the way that after everything is done and they're going through the door, by the way, and that's the one that really is what's important. So that's
I
you
want to
give me definite
mention,
pause for pause.
definitely, I want to mention two quick things before we get into the Q&A. When a man is in his late teenage years, 20s and 30s, he's expected to be virile. The attainment of erections, they're supposed to happen like that. No difficulties at all. But we know it can happen for different reasons. The age of erectile dysfunction is getting lesser and lesser. Men in their 20s are presenting with erectile issues. But the ability to have an erection is determined by multiple factors all occurring within the same organism, within the human being at the same time. You
Wow.
must have a good libido. You must have, that's the appetite. The appetite, you must have a good appetite. You must have a good blood supply. The
Mm-hmm.
attainment of an erection points to the health of the blood vessels in the organ.
That's
That's
true.
a bold and true statement. But there can be neurologic factors as well that can retard this, and there can be hormonal factors that can influence this. So if we were to cast,
Wow.
or let me back up and say it a different way. When I was in medical school, it was said that 10% of erectile problems are psychologic. No, not psychologic, are physical, and 90% are psychologic.
Right.
That's what they've swung it around now. They're actually saying most cases of ED are due to physical changes, and the stress, the psychological factors are in the minority. And
Really?
the yeah. Oh, Lana, let me plug in here. I'm losing charge.
Oh, that's fine. That's okay. We that's I think we have we've got well
Great.
yeah. So everyone is gonna hold off with their questions until you finish. So
Yeah.
that's fine. We're waiting
Right.
on you. So keep continue.
So just exposing erectile dysfunction a little bit.
Mm-hmm.
The ability to get an erection, testosterone is important.
Right.
Blood vessels are important. The
Right.
nerves are important, and the brain is important. All right. If you have a breakdown of any one of those potential pathways, then that person can have erectile dysfunction, which really is the inability to attain or maintain an erection that's good enough for sex. It is estimated that 75%, and this is a worldwide figure, 75% of erectile dysfunction is never discussed with a medical practitioner.
Wow.
75%.
75%?
Mm-hmm. So the persons who expose ED to a doctor are in the far minority, 25% of cases.
Okay. Right. So they don't mention it, but we know that it's vitally important, not just because, as it is said, I've heard, and you kind of alluded to it, erectile health is linked with brain health, is linked with heart health. So it is not just a matter of down there, the nether regions being important, and we're only focusing on that. That actually, if something is going wrong there, something is going wrong with your heart because it
This
is
is
the
it. I
blood
want to
supply.
stress on that. I want to stress on that because that's a very important point. People normally say, including doctors, that if you
Yes,
have heart disease and you have erectile dysfunction, they don't link the two as being cause and effect. They think
right,
it's on two similar parallels. But we as doctors, we now know if you have erectile dysfunction, the chance of the underlying process that caused the ED causing a similar issue in the heart is high. In other
yeah,
words, you may be an apparently fit man in your 40s, you have erectile dysfunction, you need right away to be screened for heart disease. That's where we
And,
are.
and we just need to say that you need to be
Yeah,
screened right away for heart
yeah.
disease, because
Heart disease.
if blood can't if it's not enough blood supply to provide for, you would say, a smaller organ, then that translates back into, because it's all circulation, it translates to the organ that is given the blood supply, the heart. So, gents,
Yeah,
please hear what Dr. Lewis is saying. Please hear this. And if nothing else, think if there's anything happening there, my heart is at risk. My
yes,
life
yes.
is at
So
risk.
erectile dysfunction, heart health, the two go hand in hand. Now, it's a big topic. I don't think we want to get into all the specific causes outside of heart disease, outside of blocked blood vessels, and so on.
Yeah.
There are many other causes, but it is a very important part of male health. A sex life is very, very important, very fulfilling, brings a lot of joy. Um, Again, the specialists involve family practitioners, urologists. Urologists are your best friend when you're having problems with the equipment. And just to mention that there's a lot of work going into non-invasive ways of treating erectile dysfunction that is due to vascular causes or blood-related causes. I know in Florida now there's a high focus ultrasound therapy that they're getting reasonable results with if they've proven that the erectile dysfunction can be reversed. There's actually ultrasound energy used to break up little plaques, preventing the blood from inflowing to the penis and so on. And ultimately, some men do choose to have penile implants and so on. Why go all to all that length to have an erection? Because it's important. It's important. So men should just know that, erectile dysfunction, get your heart checked. If your heart is good, then see your urologist and you may be able to be helped. Now, in our 40s and 50s, that same testosterone can and will affect another organ in the body called the prostate.
Okay. Oh,
The
we
prostate
done
gland, that's the
fabulous
big word that everybody talks about prostate disease.
first.
I'm
Yes.
not going to go down the usual road of talking about how much prostate cancer there's around and what are the hypotheses as to why the numbers in Barbados are high. And no, what I want to say to a man is this: the prostate has one function in the body. The prostate is actually there to produce fluid to nourish the semen. The prostate fluid plus the sperm is seminal fluid. Seminal fluid, right? The prostate is a nourishing organ. It's not very big when we're young, but as we get older and the prostate begins to swell, it gives us problems. And I'm not even talking prostate cancer yet. But from an anatomy point of view, if you were to draw an X, right at the center of the X is the prostate. The above limbs would be the kidneys,
Okay. Mm-hmm.
prostate. On one lower limb, you have the testicle. Then the other limb, you have the penis.
Right.
The penis is
Hope
the
y'all
exit
got that
point.
visual, but don't worry, you can always rewatch that. It's no problem.
The point is the prostate
Quite a visual.
occupies a position that is at the intersection
Mm-hmm.
of the urinary system
Yes.
and the sex system.
Right.
So the prostate is where sperm meets urine,
That's it.
technically.
Yes.
The sperm, the prostate fluid and sperm exit into the penis, and the urine exit into the penis as well. Now, that's why when prostate disease is or prostate issues are niggling at us, That's why we get urinary symptoms. And
Yes.
men need to know you don't have to wait for sexual difficulties to think you have prostate disease. You don't have to wait to have erectile dysfunction. You don't have to wait for blood to occur in your sperm. You just need to have subtle changes in your urinary habits. Urinary habits. And this may reflect that you have a prostate issue simply because of the anatomy where the prostate is located at the junction of the two systems.
Okay. So we do have some men in the audience. We have some mostly females as usual. So ladies, as usual, not give you a task, but gentle reminder to the gents in your life that the ones that you're closest to, you can mention these issues to. We have to urinate every single day. That's the given. In females, there are separate areas, sexual areas from urinary tract areas. In men, it's all one area. So
One
if you
year.
are having a problem, gentlemen, with your urinary tract, think of that as, however small it starts, that that will escalate, or that will mean something also for your sexual drive, for your sexual function, especially for your 30s, 40s, 50s, and let's face it, 60s and 70s, because there are 70-year-olds who are very active as well, and who may be having enlarged prostates, and who might be having difficulty with passing urine, and may not connect the dots that urine
Yeah.
problem may be erectile problem. So I
Yeah.
think that's a really important point to just see that in your mind's eye. These two meet at the same point, and one interruption in one can mean interruption in the other.
Yes. And I want to, the list is there. And I want men and women to realize that that old man with, urine trickling down his trouser, it happens a
Yes,
lot. We see it in
yes.
public. That's
Mm-hmm.
going to be us. The younger men, we will get there once we live long enough because that's how common prostate disease is. And that urine is trickling not because of kidney disease, that's because of prostate issues. And we'll get into that just now. Um, do not accept that the natural aging process causes leaks down below. It can be
Correct.
giving you a hint that your prostate is becoming a problem. The challenge with differentiating between the usual benign or what Bayesians call the enlarged prostate, the
Mm-hmm.
problem with differentiating between that and a cancer prostate is that the two give
Mm-hmm.
exactly the same symptoms.
Yeah. Oh,
Yeah, it's exactly the same symptoms. I mean, few things added on either side, but an enlarged prostate, which most men will get starting in your 40s, an enlarged prostate or a cancer prostate will give you increased urination at night, the urge to pass urine, especially when you're close to the bathroom. You feel like the last couple of steps you really have to dash off.
yes.
Hesitation of urine. You go over the toilet and you're waiting to pass urine and you have to wait the extra seconds longer. Post voiding dribbling, after you finish, you think you're done and you realize, no, there's still someone there to come out. Post voiding dribbling. That list of urinary habits can obtain for both a non-cancer prostate and a cancer prostate. So how can we differentiate the two? By seeing a doctor. You can't just guess based on the symptoms. So a doctor has to be involved, and there's certain screening tests we can do to make sure that this is a benign condition and that it's not a cancer condition.
All right. I wish everyone could hear this, but um in the world, I mean. But this is important because it is something that is not, again, because it'll make the connection that this is the same place it's coming through. Then going to the doctor, you think, oh, I don't need to mention that, or maybe that's a problem I'll talk about later on. They're connected, and they both mean not just not just quality of life, but they also, well, could literally mean life, you know.
Yeah, yeah, yeah. Literally, literally. And I was going to say something that just slipped me.
Right. Okay.
Senior
Well,
moments.
I'm not accepting that from you at all.
At
So
all.
sorry. No,
But the point,
no.
point is, urinary symptoms should be taken seriously because they can point to the possibility of prostate cancer. Not necessarily so, but it can be a prostate cancer that's in the background causing it. And you, oh yes, I was going to say this. So of course, men being men, we like to cheat a little bit. You know, if we can get away from the physical examination of the prostate, that's what we're going to do.
Oh,
Doctors
yeah.
should not doctors should not give that option. You can do the
Oh,
blood
I
test,
never,
or you
they don't
can
have an
have,
option. I just tell them, make up in your mind. This comes once a year, like a very special occasion. Consider
yeah,
it your gift to yourself.
yeah,
And it does, and then when they're through, they're like, "Oh, that wasn't fine." I'm like, "Great." Next time
yeah,
you go with your friends and you having your dominoes and so on, tell your
yeah.
friends. Tell your
You
friends
do
it
you,
was
do
it
you
was all right.
remember? Do you remember when there was a war in Iraq?
Well,
Or you're too
yeah,
young to remember that?
a little bit. Yeah, I remember.
The American
Ish.
general, the American general that was in charge of the American troops, Norman Schwarzkopf,
Yes.
he came down with prostate cancer.
Oh yeah.
And you know, we test for prostate cancer in the blood via the PSA. The
Yes.
PSA is actually a chemical given off by the prostate to keep the sperm in a liquid environment. That's the function of PSA. It's not just a marker there for us to test to see whether it's high or low. It actually has a function. It has a function. But General Swashkoff's PSA never budged, but he had rip-roaring prostate cancer. And it is
Yeah.
something called the Swashkoffian effect, meaning in a proportion of prostate cancers, that PSA is not going to budge. Just like in breast cancer, you know, we sometimes we do a blood screen, the CA 15-3. Some people
Yes.
are not secreting that, although they have rip-roaring breast cancer. Same thing in prostate disease. So I find giving men the option is like saying to a man, the finger test, the digital rectal examination is equal to the blood test and vice versa. That's not true. The two complement each other.
They
A
do.
full examination is the rectal examination plus the blood test.
Yes, it is. And they can't, and they go together.
You, if you
So
take one in isolation and you try to rely on that, you may have this Schwarzkopf effect. Yeah, you may have a normal PSA, but something is still going on, and the digital exam may have picked it up. So you
oh,
should
I've
do the
seen
both.
that many a time.
Many a time,
And
you should do both.
many a time. And gentlemen, I must say, I'm speaking for my patient load, but it does, as you said earlier, require trust and a back and forth and a team effort between doctor and patient. So I am thankful that my patients, we have that rapport where it's like, okay, they automatically now know, all right, doc, we're gonna do this one first. I explain to them what it's about, why we can't just do the blood test, what we're going to be looking for, because the fear is I might turn into something else, or this might make me incontinent, or make me a different individual, or just the pain and the embarrassment of it. So as it, well, when they've gone to the point of doing the test, I say, make up in your mind, it's once a year. They're they sigh, but they're okay. And then you come, and I think doctors really, we really do need to do a better point on explaining um, as we are doing the test. And truthfully, some male doctors do have bigger fingers than mine. My fingers are real small. So it might make it really easy for a physician, for me, to get that across than for someone whose hands, with no choice of their own, by genetics, they have bigger fingers. But explaining to a patient how they're to be positioned, how to relax, what we're doing, when we're doing, why we're feeling, what we're feeling for. We're feeling for the prostate that has a normal consistency, a prostate that has the two sides feeling, the middle of the two sides feeling normal. It has no hard lumps. Bear in mind, we can only feel one side of it, and if you feel anything wrong there, that will give us a guide as to go to the next one. And it's
Actually,
interesting
a
that
well
no matter
done
how many
physical
prostates you examine
examination,
per
right?
year, I can
A
tell,
well,
you can tell, physician knows, we can tell when a prostate feels different last year or year
mhm,
before from this year in
yeah.
any patient. And they're surprised, and we have picked that up, and PSA remain unchanged, looking nice and normal.
You can hear me, Lana?
Yes, I can.
Yes, okay. We made use of the anatomic arrangement again, whereby the prostate sits just in front the middle part of the rectum. So that
Yes.
organ that stores the stool, just in front it is the prostate. There's nothing dividing the two except a special band of tissue that we can feel through. And a well done digital rectal examination can feel up to 65% of the surface of the prostate.
Wow. Did you hear that? Up
Mhm.
to 6 5. So we can feel more than you think.
Yeah, yeah. Now,
Okay. So
I am just going to finish off. Remember at the beginning, I said there are two constructs that I think of when I start talking about men's health: societal expectations, testosterone effects. We've more or less gone through certain things that can affect a man physically that are potentially by testosterone or lack of testosterone. But,
mm,
and I probably would have to take guidance from you on this, Lana. There are other things there that are not necessarily unique to men, but again, there are things that we shouldn't take for granted. More suicides, yeah. There's a little paradox there. More men attempt suicides, but more women complete suicides.
other way.
Is the other way around?
Yeah. More men complete.
More
Women's
men
is
complete, but more
yes.
women attempt. That's right. That's
That's
right.
right.
Yeah, that's
Men
why you're the
succeed.
family physician
Exactly.
and I'm the surgeon. Yes, yes.
Yes. That's
So
right.
suicides is a massive issue right now occupying the UK to the point where at a
It is.
corporate level they're trying to implement certain things to see if they can pick up where people are actually crying for help. So
There
male
are.
suicide, hmm
No, there are. I just agree with you. Yes,
yeah, they
absolutely.
are. They are. Um, I was asked to join a podcast in the UK. Um, I thought I was joining to talk about a surgical issue, but it was sprung on me that, there's a rash of suicides within a particular company and they just wanted a male doctor to talk to them.
Yes.
Um, drug abuse, alcohol abuse, there's more of that within men. Um, it is said that stress affects men more than women. I don't know if that is true.
Women have more outlets than men, shall we say? More
No, more
circles, really.
outlets
Outlets to vent, to cry, to
for
call,
event
to,
support. Uh-huh.
yeah.
Okay.
So we
So I
tend to
think
have a bigger
when,
social circle generally.
mhm. But why is that?
Well, I think it's because the men used to be hunter gatherers and women were home with the children, and then they formed a circle, and estrogen and is a gathering and nurturing hormone. So women tend to do that. Men
Yeah.
love to solve. Men are designed to solve problems, not
Mhm.
necessarily nurture and call you and listen to your biggest, deepest, darkest problems. Whereas
Yeah.
we tend to
Yeah.
feed off each other. It can be negative too, but we do have our circle. Men tend not to have a circle, but I counter that by saying men can have men sheds where they're fixing cars, where they're teaching, mentoring younger ones, where they're having the domino play. And those are fantastic areas where they can still have, it might not sound like a social group, but there's not enough of it, or it's not utilized as it could be.
Well, that opens the door now to what are the challenges and challengers to the man's role in society, but we're not going there tonight.
No, no, no. So we've done from head to toe. I cannot believe. I mean, every single time we had so many. I say gremlins, but I don't know what these were in the system tonight. But I thank all of you for your patience, your attendance. The attendance um, has still the quality of questions. Thank you. The interest and the enthusiasm has been fantastic. We've had male and female participants. We've had persons from different countries. So even though numbers not always tend to tell the story, the quality of the conversation tells the story. So I want to just personally thank you for the head to toe. Well, we'll get into the toe discussion, but men, just take care of your feet, let's just say. It is also Diabetes Awareness Month. So we will be talking a bit more about that. But thank you, Mr. Lewis, for opening the discussion. I did some last week from my female perspective, but you opened it in a way that men can understand the crisscross, the connection, the tubing, the wiring, the firing, literally, and heart disease and prostate health and urine health are all the same. I want to just thank you from the bottom of my heart again. And Aura unbelievably is up. But I will sanction. I am going to not to just to you, but I'm going to put a challenge out to my colleagues, to whom I who join in on this chat as well sometimes, and who give me feedback. Miss Adamson has made a fantastic point. There is a real need for a public education program that puts information like this. The link between erectile dysfunction and heart disease. I dare say, Ms. Adamson, this has been done many times. They have flyers, there are things done, but people who need to hear the message are not hearing it. And that is true. And that is always true. We always end up preaching to the converted when we have messages like these. The ones who really need it don't get it because they don't come to access it. So what we do need is community fora, as opposed to doctors talking to doctors. We do need, oh, music lover is back here. Oh, hello. He's great. Well, we're on the same boat, so to speak. No pun intended. More men's forward groups. We need to have more men's, like, not just men's health groups, but male forum where you have a health professional, nutritionist. Yes, you have your female. Yes, you have diverse topics, but not in a didactic way, in a way that we're talking. We're whole, we're chilling. I'm wearing blue because blue is the color of diabetes awareness, and it is the color of men's health. So I'm not just randomly choosing colors. So if you're going to wear your blue this month, wear your blue this month. Bear in mind, is these are all it means something. That's just a side point. But I want to say from Sparkles, oh, my brother. Oh, hello. But he's a male caregiver, and he also is very into men's health, and he's also had dealt and seen how men's health challenges go, literally because his granddad died at 99. So he saw how all those challenges went from, you could say, A to Z. But I agree with you, Tony Sparkles, that more men's forum. So the challenge to my colleagues that we can have more community, diverse places, not necessarily where we're talking to you, but we have a round table, and it doesn't have to be every month. We can pick a time. So we will discuss that among ourselves. The others have given us they've thrown on the gauntlet. I think we can pick it up. So thank you all very much for that conversation, that comment. And then Miss Julie, hi Julie. Oh, thank you for joining. She says everything regarding the prostate. She's very grateful to you, Mr. Ian, Dr. Ian. He's actually officially Mr. Ian Lewis, because you go from Mr. to doctor back to Mr. the more qualified you are. So he's back to his original because he's one of the most senior doctors we have. He looks like 25, but he's over 400, I assure you. She said, "Thank you very much for the details on prostate. She will pass it on to her husband." And I encourage, we did that all throughout, brother, sister, husband, spouse, friend, best friend. Please pass it on to the gents. They may not have wanted to join. Some did. Some brave male souls they'll join. But generally speaking, let's have some fora. Let's talk about it, you and me, Ian, and one or two others who we know
Yeah.
will be doing that. And I'll leave the final word to you while I sign off on everyone. First, I'll sign. Good morning, good evening, good night. Thank you, Mr. Lewis. Thank you, audience. Thank you for being patient with all the dragons we had in the system tonight. And the discussion on men's health can go on forever because there's so much to talk about, but we've opened the door. And I'm so grateful that you were here to open the door with us and to clarify things, to clear the muddy waters. So thank you wherever you may be. Keep leaving your comments and questions. We will address them. And wherever you are, have a great, take care of your feet. If you're diabetic, take care of your health. Be mindful of your own body. It tells you the stories. So pay attention. And from my heart to yours, that's what I have to say, Dr. Lana. So I'll leave the last word to Mr. Lewis. So, Dr. Ian, carry on.
Well, thanks again for having me. Your universal audience. Um, Men's health, let's make it as sexy and as interesting as female health. I agree. The fora need to be more in number, more vocal. We need to get the men out. That's something I hate to say. We need to, rather than we are going to. But thanks for having me, Lana. I hope I brought over effectively that a man is not just a prostate, as important as prostates are. We have to think of the kind of subtle things that men may want to talk to us about, but that invisible shield is keeping them away. The suicides, the alcohol, drug abuse, loss of hair, male breast issues, and
Yeah,
then ultimately erectile dysfunction, prostate issues. These are things that make men men. And maybe once we find the right formula, men will approach us more and we can help more men to lead a more fulfilling life. Thank you.
very so welcome. But before you go, I did want to say that Miss Pilgrim, she said there's a lot of marketing. This is not necessarily to answer, just to make sure I include everyone's point. She did mention we had talked about ED drugs earlier, but she said there's a lot of marketing to help with erectile dysfunction. And should that be just a yes or no, just for brevity? Should that be approached with caution, or is it okay, or do we go more with the traditional erectile dysfunction medications or herbal erectile dysfunction medication?
Cannot be answered by yes or no, but I would say
I knew you were going to say that.
I, I would say they work, but patients really need to be screened properly before they embark on a program of using them, right? I think in the UK now you can get Viagra without a prescription. I hope we don't go in that direction in
So do
Barbados.
I. So do I.
Yeah.
That
Yeah.
would create a whole can of worms that I
They're
really don't
drugs
want
that
to
they need to be approached with caution.
approach with caution. There you go. I
Yeah.
think so.
Yeah.
So again, thank you everyone. Have a great night's rest or wherever you may be, morning or evening. My friends in Australia, it's morning time. So enjoy your day. And thank you all. We will continue our men's health discussion all month. And just be aware that a doctor's visit is not a punishment, it's actually a gift to yourself. And if you are feeling uncomfortable with your doctor, there are just as find one with whom you can establish that rapport, one who will explain to you, like how Dr. Ian just did so well, and then you will be more comfortable talking. Make it conversation, make it a forum, make it normal part of conversation. We eating our family meal, we talking about prostate health. You're having a drink with the boys, you're talking about mental health. You're having a family discussion about something, or you're watching TV and a joke. We talk about make it normal in the conversation. So thank you all. Hi, Allison. Hi, Wanel, who says thank you. Rhonda, who is one of our top chat people, and Music Lover, and Miss Pilgrim. Oh, and everyone else. Wonderful discussion. Dr. Ian, I can't thank you enough. And the rest of the year is just one more month to go. So we will we will carry on the discussion without your glorious presence, but never mind. Feel free to pop in at any point, and I'll leave the rest of the questions. I'll send other questions as they come to you. So have a wonderful night and day,
All right.
everyone, and take good care. Thank
Take care.
you.
All right.
Bye.
Okay.
Gonna end the live.